Bree and Jason, Sonia Siliong stood before Governor Eddie Calvo this morning and explained the reason behind a donation from the Bureau of Statistics and Plans Employee Association. The donation stemmed from a visit from one employee to a relative in the maternity ward.
Because of the shortage of receiving blankets, they wrapped a newborn baby in some old bath towels, and they were also being wrapped in hospital gowns, like adult size. And so it kind of touched us, and we raised a little money, and we would, on behalf of our employee association, we would like to donate.
The donation is just another example of the dire financial situation at the hospital. Governor Eddie Calvo thanked her for her commitment to GMH.
The other day we did visit the maternity ward. That was what they were asking for blankets for the newborns. So you kind of read our minds as well. But thank you so much. And again, every donation counts.
Meanwhile, Calvo had a very different message for Guam Public Utilities, who have been threatening to cut off power and water at GMH. Senators on Wednesday passed Bill 237, which appropriates $1.1 million for outstanding bills to Guam Power and Guam Waterworks authorities. Both agencies have threatened disconnection if the hospital doesn't pay its bill in full.
The power and water will not shut down in this hospital. If that were to occur, or even any movement by utility to do it, then I would have to move in my organic authority.
Calvo said when utilities faced major issues in the past, Gov Guam stepped up to help.
The airport had to get off the grid to help the utilities. And at the same time, EPA has done many things to help the utilities in their time of need. And I'm sure that they would grant this hospital, which is a health and safety institution that is critical for the people of Guam, that they will also assist as well.
GMH Chief Financial Officer Benita Menglotnya mirrored these sentiments.
GMH has been in the news for, amongst other things, because of its finances, and unlike the utility agencies who's been after us to pay the bills, we can't cut off services regardless of the person's ability to pay.
This declaration comes on the heels of a GMH Management Advisory Team meeting held this morning. Member Will Castro.
It was a very dynamic and fruitful discussion with hospital staff in identifying revenue-generating opportunities beyond what's currently being realized.
Some opportunities could include adjusting internal policies or even updating outdated fee structures even further to prevent the hospital from losing money. He said in the race against the clock, the team is working tirelessly to bring GMH into the black. Bree and Jason, back to you.